Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. I'm excited to bring to you today a conversation with Dr. Jenna LeComte-Hinely, who is the CEO of HARC. And HARC is the Health Assessment and Research for Communities organization. Welcome, Jenna.
Thank you, Will. I'm so happy to be here.
I am happy to have you here. I wanted to talk a little bit about something that you have going on in the community right now. It's something you do every 3 years. It's a community health survey. Talk a little bit about that and what that is.
That's right. Thank you. So this really goes back to HARC's creation and inception. The idea is that Riverside County is a huge county, right? We're bigger than some U.S. states. And there's great county level data available to talk about our health and our needs, but that data doesn't tell our story here in the Coachella Valley because we're different. And the data is skewed by the more populated Western Riverside County. So organizations here couldn't really tell their story. They couldn't document their progress. And so HARC was created, including with leadership from Desert Healthcare District and Foundation, in 2006 to solve that problem. And the idea was that we would do a survey of the health of our Coachella Valley community, and we would provide that data back to the community at no charge every 3 years. So this data, this survey that we do, those topics aren't driven by a model or a theory or anything like that. They're driven by our community members coming to us and saying, hey, I really need to know X, Y, Z, and I can't find that data anywhere else. And not all topics are appropriate for it. For instance, we gather data from adults and adult proxies on behalf of their kids. And so one time somebody came to me and said, I need good data on bullying. And I couldn't include that on the survey because unfortunately parents are often the last to know. And so that would underrepresent the data if we asked parents, is your child being bullied? But for the most part, we can be very responsive to our community when they're saying, I need to know X, Y, Z. And so one of the exciting things and why I'm here today is we have seen such an uptick in an interest in environmental justice that on our most recent survey, the 2022, we added some questions about air quality. And for this current survey that we're undertaking right now, the 2025, we expanded on those. We added some questions about disaster preparedness, and we added some questions about the impact of natural disasters, such as wildfires or smoke or flooding or all sorts of things, so that we can get a better picture of the environmental health that our residents experience.
That is fascinating, the environmental justice part of that. Can you give me some examples of the questions that were asked in 2022 regarding air quality?
Yeah, one of my favorites is we ask people, how would you rate the air quality in your neighborhood? You know, is it poor, fair, good, pretty good, excellent? We also ask them whether outdoor air quality, whether it stops, the air quality is so poor that it stops them from doing things they want to do outside. I think we can all resonate with this. It's been windy here recently, and my mother came to visit, and she said, I tried to go for a walk, and I couldn't. It was too windy. It was too sandy. I was getting a mouthful of sand. And I think that's a very important piece of our health. You know, often most data sets that measure air quality are focused on PM 2.5, PM 10, because those size of air quality, of particulates in our air quality, those are the ones that give you asthma, that can cause lung damage, that have all these detrimental long-term effects. Whereas something like sand is not considered something that will really be detrimental to your health in the long run because your body is designed to expel that. However, it has a very real impact on our quality of life, right? Again, if you can't go outside because it's too dusty out because the sand is blowing, if you can't drive because you can't see the wash, you know, these have very real impacts on people's health in a myriad of ways, not just on your respiratory health.
Absolutely. So what are some ways that this impacts your life other than your health? I mean, we hear about road closures, that sort of thing, which delays where you're going, how you live your life, that sort of thing.
Yeah. And I mean, let me give you an example. My husband and I have 2 vehicles, but one of them doesn't have air conditioning.
Oh.
So for a big part of the year, that vehicle is only drivable with the windows down. On a beautiful, still day, that's not a problem. But on a day where the wind is blowing and the sand is whipping through there, that is not a feasible vehicle. So at that point, if I had a doctor's appointment and my husband had something else to do, that's a barrier, right? That's a barrier to me accessing care because we only have one vehicle, functionally speaking,
right,
during these adverse weather events. So it can impact us in all types of ways. In fact, even economically, right? People don't want to come here and be covered in dust. They want to come here and engage in our beautiful outdoor activities, and they want to go on hikes, and they want to go climb our beautiful mountains, and they can't do that if there's poor air quality. So it has long range impacts, I think, on every aspect of our life because the air that we breathe is involved in every aspect of our lives.
I believe I read in some of the research that you sent me that from 2022, the data collected showed that people in the Eastern Valley really, they are impacted in terms of their daily activities.
Absolutely, yes. So basically, 45% of people in the West Valley said that their outdoor activities were at least somewhat limited due to poor air quality. But in the East Valley, that was 64%. So more than half of people say that their outdoor activities are limited because of air quality. And that's not to say that the West Valley is fine. 45% is a lot, too. And there's definitely certain pockets where it's more prevalent. For instance, Desert Hot Springs has some crazy winds sometimes that can really kick up the dust. But on the East Valley side, you also have to consider the emissions from the Salton Sea, whether that's the drying of the playa that has evaporated and is in the air, whether that's pesticides that have been used in the soil, or whether that's that sulfur smell that we smell coming off of the sea sometimes. So there's a wide variety of different things. We're very lucky here that we don't have a lot of factories or anything like that creating emissions, but we live on the 10 freeway. We have so many trucks. We're now getting more and more warehouses on either sides and even within the Coachella Valley. And so that logistics and trucking and the emissions that come from that are not inconsequential.
That's right. I want to go back to talking about the Salton Sea because what I believe I understand is that the impact on children and symptoms of asthma has been really significant.
Yes, we were fortunate enough to do a study on asthma in the Salton Sea area, both Riverside and Imperial County. We did that with UC Riverside. And the thing that people had been sort of stumped by in the past was the idea that you should be seeing higher incidences of asthma out by the Salton Sea. And they weren't seeing that. And so somebody said to me, well, why do you think that is? And I said, well, you're clearly not from here. What you don't realize is that many of the people who live very close into the Salton Sea are very low income, and they may not have health care. They may not have a primary care provider. So they may have asthma, but they don't have an asthma diagnosis. So what you're actually seeing is higher incidence of people going to the emergency room to handle their asthma, but a lower incidence of asthma diagnoses because they're not getting diagnosed. So we worked with a pulmonologist to design this study to look at asthma symptoms as well as other respiratory issues, including nosebleeds, even eczema, which can be impacted by air quality. And sure enough, we found that there are much higher incidences of childhood asthma symptoms around the Salton Sea than there are diagnoses, and it is particularly high on the Imperial Valley side. It's interesting because the playa isn't evaporating all at the same rate, right? And so it's also a very under-resourced place in terms of healthcare facilities. You know, there's a few tiny inner care clinics around the edges, but it's fairly a healthcare desert. And I know that Desert Healthcare District and Inner Care and others like you all are working on mobile units and free healthcare clinics like the Flying Doctors, Los Médicos Voladores. But for many of these people, that is their only opportunity to get any healthcare to address these respiratory issues or other issues caused by air quality.
Air quality is such an important issue, as you've stated. It's one of the reasons why we wanted to do an environmental health summit. We had our first one in September 2024. We're doing it again in September 2025. Because I know you were a panelist at that first summit, and it was all about data collection. Could you speak to, were there any surprises for you in terms of the outcomes of the survey that you did in 2022?
Surprises. I think there's always some interesting surprises. And one of the things we did some focus groups around this issue of the environment and air quality. And a lot of what the community had to say were very basic things that should be rights. What they wanted to see for their ideal local environment, they said they wanted clean air, they wanted potable water, they wanted more parks and green spaces, they wanted affordable trash service. You don't really think of that when you think of the environment, but It's very relevant. These were these things that you would expect to see from a third world country that we're talking about. The issue of water at some of the mobile home parks, they operate on wells that are not regulated, and many of them have been found to have arsenic in them. And a lot of the residents, they know not to drink it. and they buy huge amounts of bottled water for consumption. But they're washing their dishes with it. They're bathing in it. This is not a situation we should have for anybody, much less these communities and these families with children.
Right, especially in this country, especially in this community. When you think about the Coachella Valley, how this would never be an issue for certain segments of this community.
Right.
And yet there are a lot of people dealing with this.
Who live just down the road.
Right.
You know, I think that's one of the things I love about looking at Coachella Valley data is we have such startling contrasts. You know, we have such hyper wealthy living just a few miles from some people who are living in deplorable conditions and who are dealing with extreme heat on a day-to-day basis, who are dealing with air pollution. And that, to me, is part of why we all should work together. I mean, it's everybody's air, right? It doesn't change based on how wealthy you are. You're still breathing the same air. You likely are able to have a job where you don't get exposed to other environmental issues, like, say, pesticides. But this is something that impacts all of us, and so we all need to come together to address it.
And you mentioned pesticides. We have a very large agricultural community, a lot of farm workers who are out in the air, the atmosphere every day, and I'm sure they're being impacted by this as well.
Absolutely. And many of our farms are dedicated, I don't want to villainize our farms, are dedicated to making sure that these are viable solutions, that they use organic pesticides, et cetera, but not everybody does. And many of our migrant farm workers may themselves be undocumented or may have someone in their family who's undocumented. And increasingly, with the immigration rhetoric, they are afraid to go seek treatment, even at a free clinic, even at Volunteers in Medicine. So we're experiencing, essentially, people who are at risk for all these negative health outcomes, who are under-resourced and who are now afraid to go access the resources we have. So I think using our local nonprofits, our trusted messengers, is so important to reaching that population, to encourage them that we are here for them, that we're here to protect and promote their health.
That's wonderful and absolutely necessary. You were talking about some additional questions on the new survey related to air quality, wildfires. What are some of the other topics?
Yes, we have wildfires. We have smoke from wildfires. We have flooding, which when I first moved to the desert, I would have thought was a joke. But then we had tropical storm
Hillary.
Hillary came through last year. And oh my gosh, I thought my tree was going to fall into my house. So that's certainly an issue. And, you know, parts of Cathedral City are still trying to recover from the floods. And we also have earthquake, as we felt
recently. Yes.
Yes. And we live right on top of the San Andreas Fault. So it's not unrealistic to expect that we should be prepared for these sorts of things. And it'll be interesting to see how much this has impacted people's daily lives. I'm really excited for the data to come in.
Yes. And as you said, we're certainly feeling the impact of Tropical Storm Hillary still. That's one of the reasons why we wanted to do an environmental health summit, because people were struggling to understand why this happened.
Yes.
So ideally, what do you want to become of the data that's collected? You gather a lot of important information in an ideal world, what would happen next?
So a lot of our data is used to prioritize health needs, because as much as you and I want to uplift everyone in all aspects, that's just not feasible, right? You got to focus your efforts. And so our data has helped many to focus in on what is most prevalent, what is most harmful to our community, what can we address? Or on the flip side, where do we have strengths that others don't, that we can build on to address these issues? Where do we have great synergy of multiple organizations pulling together? So I think that's the first step, is using it to prioritize. What are we going to address? And then the second piece of that is, how do we address that? And that, again, should always be based on the community's input. You know, we ask the community, what makes it an ideal environment? What do you want to see? How would you address this? Because it's not necessarily the same way I would address it. You know, everybody accesses things differently. And the third way is to justify their request for funding for those programs and services. So our data helps a lot of the nonprofits here to support their grant requests or asks or other requests for funding. Because it's one thing to say, hey, this is a huge problem. Please give me money to address it. It's another to say, this impacts 2,000 people, or this impacts 20,000 people, or this impacts 200,000 people. Look at the data that this third-party objective source has collected, and please help me help those 2,000, 20,000, 200,000 people. So it makes it very compelling, very real, and very measurable. You know, there's a saying that you can't improve anything without measurement. You have to be able to measure your change. And so without that, we're all just sort of hoping that we're helping, right? And so our data helps people to prioritize those needs, design programs and services to address those needs, get that money from outside agencies to fund it, and then measure the difference that they've made.
And one of the things the data does is that it gets everyone on the same page.
Yes.
There's so many organizations working separately, doing their best and trying to address issues. But when you have data that shows this is the issue,
yes,
this is affecting this number of people, then more organizations can get on board.
And that's the interesting thing, you know, like, say, for instance, a hospital will have data on major disease, how many people have been diagnosed with diabetes, but it's not capturing those people who don't go to that hospital, right? That's why it's important to have population level surveys like HARCs, because we can tell you how many people across the valley have been diagnosed with diabetes, and that may not be the people who are getting seen and who are getting treatment. One of my favorite stories about how the data was used to bring in funds was Jack Newby, who has worked at several of our senior centers, Jocelyn Center and Mizell, and he said he always used our data on food insecurity in seniors. And he said, people like the Desert Healthcare District, you guys get it. You're here in the community. You know what our community is like. But outsiders, they hear Palm Springs and they think, oh, rich white guys playing golf. And to be fair, that's true. We have a lot of rich white guys playing golf. But we also have many others. And so Jack said, well, your data helps me tell that story of the thousands and thousands of seniors who had to cut the size of their meals or skip meals because they didn't have enough money for food. And that is able to connect with these people who have never been here. And they can see, okay, senior food insecurity is a real issue. And they can then fund programs like the Meals on Wheels program that delivers meals to homebound low-income seniors 6 days a week.
Right. The perception of being in the valley, that's huge. You mentioned your mother going out for a walk and never expecting that she would not be able to walk. There is a perception about our Coachella Valley just being beautiful, 365 days of just clear skies. And it is beautiful, but there are those challenges here as well. If people are not paying attention to this data that you're collecting, what do you foresee happening? I know that's pretty broad, but just some examples of what could happen.
Overall calamity. No, I think addressing issues based on gut instinct is fine to a degree. But if you truly want to impact and to make positive change, if you really want to affect change, you need to do it from a data-driven standpoint. You can't do it based on what you see in your neighborhood or that sort of thing. It needs to if you see something in your neighborhood and you work to address it, that's great for your neighborhood. But if you want widespread population improvement, you need to come to it from a data-driven perspective. And so I think that's why having data is the foundation of improving health in all ways. And I was at an event that was talking about environmental justice, and one of the panelists said, it's an environmental injustice to not have data available to the public. And
wow.
I cheered because I really do think that's true. And in this current climate where some data sets are disappearing or going offline and we don't know, I think it's more important than ever for a community to own their own data. And that's what HARC's data is. It's data that's owned by our community and it's not going anywhere.
Which is why it is especially important that if you receive this survey in the mail, that you complete it.
Yes.
How many were sent out?
So to date, we've sent out invitations to 25,000 households and P.O. boxes around the Coachella Valley, random sample. So anybody has an equal chance of getting it. And in it is a flyer that says in English and Spanish, hey, please take this survey. They can go online to take it, or they can call us and we'll send them a paper survey. And in it is a $2 bill, and that's theirs to keep whether or not they take it. It's interesting. The research shows that this type of pre-incentive, as we call it, really does increase the number of people who take the survey. And then if they do take the survey, thanks to funding from Desert Healthcare District and Foundation, they get a $20 Visa card. And so we've seen that's very popular, let me tell you.
That's very cool, yes.
But it's important. A lot of people sort of disregard incentives when it comes to surveys. But if you think about it, there's no other way to get this data than asking our community. This is essentially, they are experts in their own experience, in their own health, in their own lives. And so we should pay them as experts for their time. This is like an expert consultation. And without their participation, this data wouldn't happen. So in terms of equity, I think compensating people for taking the time to take this survey is really important, especially among our most vulnerable communities who, if you're working 3 jobs and you don't have time to take this survey, well, maybe you'll take it if you get $20 to take it, because I want to hear your voice too.
Yes. So for all of our listeners out there, you have your own experience with air quality, with health issues, concerns in the valley. It's important for you to share those.
Absolutely.
Because they're valuable and they're going to help us all make a difference, improve the quality of life in the Coachella Valley.
Absolutely. And it's not one of these things where, oh, you take a survey and you never hear from them again. Like, this data will be released back to the community for free. It'll be available on our website. We do everything we can to make it easy to digest. So we've done, yes, written reports that are pretty intense, but we also do infographics and data briefs. We even did a coloring book once because we want to make data as accessible as possible, and we want to put it in the hands of people who can take it and use it and do great things with it. So that's very important to us, that it's not our data, it's everyone's data in the community, and everyone should deserve to have it.
Amen. Jenna, thank you so much for being on the podcast. I hope that when the data results come in, you'll come back and we can talk about that.
Oh, I can't wait.
That's going to be fascinating. Okay, this is Will Dean, your host. Thank you again, and I'll see you next time.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.org. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music.